as a conventionally trained medical doctor, I kept seeing cases that people were coming to me and saying, my doctor says I'm fine, but I don't feel fine. So I was just that type of person that needed to go and get more training. And so that's what I did, is I kept getting more and more training. And one of the things that I found that I resonated with was doing functional medicine. And what I liked best about functional medicine was it went back to the biochemistry that I was taught in medical school. And I remembered one of my favorite professors in medical school actually trained us in this. We called her Ma Hilton because she was like a mother to us. Her name was Mary A. Hilton. But what I loved about it was I was like, oh my gosh, now all these things they're teaching me make complete sense. So when I went to my first functional medicine training, it felt like home. I was like, finally, someone's training me not to cover up symptoms with medications, but to actually find out the root cause of actually what's going on. And so once I've started doing that over the past 15 to 20 years, the results have been amazing. Let me give you for instance. So Mary was a nurse. So as a nurse, she understood medicine, and she knew that something wasn't right, even though she was on thyroid medication. She had difficulty with losing weight. She had been through every weight loss program that's out there. You know what they are. Jenny Craig, Weight Watchers. She was going to the gym every single day. She would count calories. She literally told me she had tried everything, and nothing worked. On top of that, she had swelling so bad of her legs, it went over her socks, it went over her shoes, and they had her on a diuretic medication, a thing that takes fluid off of her. It didn't make a difference, right? Her doctor kept telling her that her blood levels for her TSH were fine, and he had her on a typical medication for thyroid called Levoxyl that wasn't changing her symptoms. She was tired all the time. She had low-level depression, and antidepressants weren't helping. She was losing her hair and was very distraught over that. She had really dry skin, and to be honest with you, she just didn't feel right? So what we did was we checked her medications, we checked her labs in a different way. We checked not just a TSH, but we checked a free T3, a free T4, a reverse T3, and then we checked thyroid antibodies. Now, the average doctor doesn't check thyroid antibodies because they don't see that there's a difference in the way that they would treat people. Guess what? She didn't have run-of-the-mill low thyroid. She actually had autoimmune thyroid. She had Hashimoto's. Okay? She had no idea that she had that. We also checked her adrenal levels with cortisol on her saliva. She was burned out. She was a nurse who was working long hours and had a really stressful life with one of her children who had just been put in jail. So all these stressors were playing a role with her. She'd also gone through menopause and was told by her doctor that that hormones were bad and that she shouldn't take them. What we did was we did a comprehensive program. We first did a detoxification just to clean all of her cells up and get them working properly. We put her on a special diet that eliminated certain foods from her diet and allowed her body to be able to heal without having those foods. We treated her empirically for a leaky gut because we know that people with autoimmune disease more than likely have that. And we changed her thyroid because her testing showed that her T4 was fine, but her T3 level was low. So she wasn't converting T4 to T3. Now, let me explain that to you. There are no T4 receptors in the body. There's only T3 receptors. Your body has to take the T4 that your thyroid makes and has to convert it to T3. There are T3 medications, and there are medications that actually contain T4 and T3. So we put her on one of those. Let me tell you what the outcome was. Oh, by the way, we also put her on low-dose naltrexone, which has been shown to reverse any autoimmune condition, and has been shown to help sleep and not affect any side effects at all for people. On top of that, we put her on bioidentical hormone replacement therapy and discussed with her what the differences were and what conventional hormone therapy is and what bioidentical hormone therapy is, and what the risk and benefits were. And she felt like with the 4 leading causes of death being related to estrogen, that it was worth a trial for her to go on some natural hormone replacement therapy. Let me tell you what the outcome was. In 3 months, all the swelling was gone. She was off her medications for diabetes, which I didn't tell you that she had. She had tons of energy. She lost 25 pounds. Her hair was gorgeous again, and she wasn't tired at work anymore. And her depression that she had had basically for about 20 years was gone. Okay? So, every single thing on her list that wasn't better was better within 3 months. And she thought that was never going to be possible. Now, here's what's interesting. She found that her swelling of her ankles was related to her eating wheat or gluten. So, guess what happened every time that she went off of her diet? Her swelling came back and she didn't feel as good. So that was a really good feedback for her of knowing that she needed to be off of that food, which may have been one of her biggest issues. So I just saw her back after, I think we treated her about a year and a half ago, and all of her symptoms are well controlled. As long as she follows her diet, she does fantastic.